Hello, everyone. I'd like to introduce myself very briefly. My name is Inge Walbrecht. I work at Navilas as a clinical trainer, and today, together with Dr. Sakinc, I will be presenting the webinar, Why Do I Treat with Navilas? Non-contact laser treatment in a private practice. Let me briefly introduce Dr. Sakinc. She studied in Hanover and did her residency at the university hospitals in Tübingen and in Marburg, and has had her own practice in Berlin since 2010, where she treats her patients with Navilas. Welcome, Ms. Sakinc.
Hello.
Perhaps you would like to give us a brief introduction. What is the setup of your practice? What spectrum do you offer? Do you do surgery? What kind of patients do you have? How many treatments do you carry out?
Well, it's primarily a conservative practice, but with a very broad spectrum, including an orthoptistic department, and the range of patients is just as diverse. We are in the center of Kreuzberg, so we have a really wide range of patients, both in terms of age and nationality. And it's very diverse, and that's exciting. And I think the range of treatments we offer is just as diverse. So primarily conservative and laser treatment. And with Navilas, I have, so to speak, covered the entire posterior segment of the eye.
How many treatments per week do you perform?
So far, I have always had one day just for laser treatments. And I exclusively do laser treatments on that day, exactly, and I've been doing that for 15 years. For a while, I had a lot of retinal tears and holes that I had to push in between. It's very tiring when you have your ongoing day-to-day business and you have to perform a retinal laser treatment in between. But if it's not urgent, you can focus on one day a week and then do it.
You decided to add retinal laser treatment to our portfolio and acquired Navilas. You didn't have a retinal laser in the beginning. Could you please explain why you chose Navilas? Perhaps you could give us a brief explanation of your decision-making process.
Yes, as I said, Navilas offers a very wide range of options for the posterior segment of the eye and also for the anterior segment, but I don't use that function at the moment, I have to say. I can treat with contact lens, I can do non-contact, I can do wide field micropulse treatments, and I can do this in very, very low dosage and very customizable patterns. And on top, of course, both the micropulse and the peripheral treatment are non-contact, and that is very convenient.
Now you have said that you also perform non-contact retinal laser treatments with the wide field objective. For which patients is a non-contact retinal laser treatment suitable?
Personally, I think it's suitable for everyone. You have to gain a bit of experience first, and you have to prepare yourself. In the beginning, you could approach it slowly and carefully until you have found the right energy dosage. Compared to the conventional standard laser devices, it is actually very comfortable both for the patient and for the doctor. With Navilas, you have a very good overview. For example, in most cases, you can easily do 80% of the PRP in one session using the wide field objective. I switch to the lens if the patients are very uncooperative. Although if you communicate this well, you can still use the non-contact wide field objective, but there are sometimes anatomically unfavorable situations where the bones protrude too far or are too deep, then you can also change. In the meantime, I have at least had the experience of thinking that if I can't reach the periphery optimally, by using a contact lens. But it is often even more difficult to reach far periphery with the contact lens than non-contact. You really have to pay close attention to the positioning of the patient and communicate this to the patient. Also, the extension or supplementation of panretinal laser treatments or retinal holes and far peripheral non-contact laser treatments with the wide field objective can be done quite well. The only thing I notice is that if patients are really very nervous and can't fixate properly, you might be safer if you use a contact lens, as it might be quicker, because with the wide field non-contact objective, the patient can blink more often and you might have to readjust. But it's still working. you can have short sessions for the second or third laser treatment. The first time, it is quite comfortable to treat the central periphery in one session with the non-contact wide field objective.
If you are planning and carrying out a treatment, how do you prepare the patient for such a non-contact laser treatment? Who else is involved in this in your practice? Do you do this by yourself? Do you need anyone else to assist you? Are there any images
So the
that you
patients
might
are
use for
prepared
this?
as usual with conjugaine or Novozyme anesthetic local eye drops and with a dilated pupil, of course. These small things should not be downplayed for their impact on the optics, ensuring that patients are really comfortable, relaxed, and know what to expect and are properly anesthetized. If necessary, if I notice that the cornea gets really dry, I additionally apply eye drops during the laser treatment. That significantly improves the image quality and also the laser treatment.
So the patient is anesthetized, dilated, and then you take an image of the fundus with the Navilas and could then integrate diagnostic images and plan the laser treatment on the fundus image. How long does the treatment planning take, approximately?
Oh, it depends a little on the patient's cooperation and the localization. If the media are clear and the patient is cooperative, it goes really quick. But if there is a cataract hemorrhage, the cornea is not completely clear, cloudy or dry, then sometimes even if you have planned everything perfectly, the effect you achieve is not always perfect. Then you realize that you have a great grid. But there are some gaps in between. You then have to fill them in again. That's when there are cloudy media. Depending on what's there, the procedure can sometimes take longer, but I think and it doesn't go any faster with other conventional laser if there are such complications, so it's still worth it.
We've just been talking about PRP patients. You also do microsecond treatments in your practice. How many patients a month do you treat with microsecond pulses?
2 or 3 on average. There are mainly CCS patients. I don't treat everything, but mainly the classic chronic CCS patients, which are mostly young people with relatively good visual acuity. But if it is chronic and there is no tendency to improve, it is a very rewarding treatment option. I have personally seen really positive effects in my clients over the course of the last 3 or 4 years. I can only confirm the positive effects. Above all, it is important to me that the micropulse laser is performed before doing PDT or any other destructive laser treatments. And if that really doesn't lead to success, you could still consider PDT as an alternative option. But I think over 60–70% show a very positive development or success over time.
Are there patients who come specifically to you because they hear that you do microsecond laser treatment?
Mostly by word of mouth. Patients who were treated talk to other patients or colleagues who have heard that we do it. With the microsecond pulse laser, you should always follow the laser protocol, and if you are careful and follow the recommendations, and I have never seen any scarring or deterioration of vision as a result of the micropulse laser treatment. However, I have seen very positive effects that can clearly be attributed to the laser. Many people have the prejudice that this is a disease that heals itself, and some people talk about homeopathic treatment. I'm not a supporter of homeopathy, nor am I an enemy, but you can't compare the two. And the micropulse laser treatment is definitely effective and worthy. It is primarily a treatment approach.
Are there any special aftercare requirements following treatment? Does this differ in any way from conventional lasering, or is this the classic aftercare as we know it?
Well, if you do the classic lasers, which is also possible with the Navilas laser, then you also have the classic aftercare options. Personally, I don't usually look at it the next day, only with CCS patients, because I'm also very curious myself, as I want to see the progress. I look at it on the first day in a week, after 4 weeks, after 3 months, and after 6 months. With PRP, if they are referrals, they get their report and then the referring doctor looks at them in a week. With my own patients, I also make sure that I schedule appointments after approximately 2 weeks so that I treat the right eye once and the left eye after, so that I control one eye and then laser the other. You can combine that.
How do patients feel about treatment with the Navilas? Do they experience it any differently, perhaps painful or unpleasant, or what is the feedback like?
Well, most of them are nervous at first. You notice that when they first arrive. But if you communicate, that eases. And above all, if you've already started and ask how they're doing, it quickly dissipates. And the patients are very relieved, so they relax relatively quickly. And I haven't seen any patients who have reported pain with PRP or have not been cooperative because it was unpleasant or painful. I really don't know that at all from Navilas.
One more question. How expensive is a non-contact retinal laser treatment compared to others? Is it covered by health insurance in the same way? Are there any differences? How does it work?
I use the Navilas laser as my sole retinal laser. In other words, I use Navilas for all medical indications. And if there are patients with statutory health insurance, we also bill the laser numbers that are intended for statutory patients as normal. And yes, you can bill the private insurance companies better. But of course, it's a mixed calculation. It makes everyday life very pleasant, so you don't have to say, oh Lord, now another PRP and the patient is in agony and in pain. I can't say that. No, quite the opposite. I think the work is more fun and enjoyable, and that's the decisive factor. It also improves my quality of life when my work is not unpleasant. And on top, I am doing something good, and I also feel very good about it.
Thank you very much. One more general question about laser treatments, about the parameters. There are the laser basics that you might learn during your studies and education. Are there any major differences to the Navilas? Is it similar? Is it comparable? How did you find your way into it?
Well, it's basically comparable in terms of the parameters. You just have to be careful with the size for PRP, for example. And the recommendations or the standard setting is 330 micrometers. But I think that's far too small, so I would recommend starting at least at 440 micrometers for PRP. Sometimes it's not even wrong to go for 490, but it's not so disproportionate that you'd say that's a huge difference. The only difference is with periphery and center. You have to be careful that you don't think I'm going to make a plan and press the pedal once and then laser everything. You really have to check the effect every time you are far peripheral and come to the center and adjust the dosage individually. Most of the time you have to lower the energy a little more peripherally than when you get to the center. But you can also remedy this by simply staying in the center for the time being. Then it is simply read quickly and the periphery is separated again. Then this constant change between energy dosage is not so great. It's then easier to rework.
Okay, thank you very much for your time. Maybe once again to conclude this nice interview, one final question. Are there any recommendations or tips for doctors or practices that are considering purchasing Navilas that would get them off to a good start?
Yes, so definitely familiarize yourself with the handling of the reader beforehand, because it is not yet the classic standard laser. But Navilas offers a lot of training, a lot of webinars, especially if you are in the clinic. And even in practice, you have a wide range of options for training and support from Navilas itself. And therefore, it's actually not a really big change if you have experience with retinal lasers and the will. Yes, you need a bit of familiarization at the beginning, but that's basically the case with every device, and I think that's normal. So I think that with the Navilas, you have an up-to-date laser device. Both the treatment report, the digital report with the documentation, with the photos and I also think the fact that you can really fine-tune the energy is a special feature. And yes, non-contact is certainly another good, convenient solution. And especially for very far periphery, I find it more complicated even with a contact lens, because they often have this bone protrusion that pushes on the laser. You can't really get that far back anyway, and it's even much easier to position the patient in a non-contact way so that you can see into the corners and angles compared the contact lens. Thank you.
Thank you very much. All right. Then I wish you a pleasant day. Goodbye.